feeling?
It's Mr. P to you.
Okay, and how are you, lovely lady? Who are you?
I'm Marge. Nice to meet you.
All right, nice to meet you, Miss Marge. So how are you feeling?
I'm feeling a little bit groggy. My legs feel weak and I get dizzy when I try to move around in bed.
Okay, well that can be normal after surgery. I just want to make sure I'm doing what I can to do to support you during this time, ma'am, mister. Okay, I'll be giving your morning meds soon, but I'm going to double check everything to make sure I'm not missing any important information, okay? I can see here that you've been prescribed lorazepam due to your anxiety, but I'm a little worried because it can cause dizziness and increase the risk of falls, especially since you're already experiencing some weakness and dizziness. Is that right, mister?
Yes, that's very scary.
Alright, since you already have mobility challenges, I'd like to check with the doctor before we give it. We definitely don't need you falling after surgery.
Thank you for looking into this. She's fallen before. I don't want to risk her getting hurt again.
Anytime. Your safety's my priority, sweetheart. Also, I can see that you're been on omeprazole for a sweet minute now. This is quite concerning because this medication can lower the calcium absorption in your body, which can increase risk of a fracture because you have a history of spinal fractures. I think I need to bring this up with the provider as well, and I'll let you know what she says.
Great.
Good morning, nurse. Is everything okay in here?
Well, good morning, doctor. I just had a couple questions about this patient's medication. She has a history of falls, and I was wondering if she could switch from lorazepam to something that might be a little less risky. I said she. I meant he. Possibly buspirone. I also noticed that she has been on omeprazole for some time now, and I'm concerned that it might be contributing to her bone loss. And do you think we should consider some different acid reducer?
That's a great catch. I'm going to switch
Lorazepam.
to the buspirone and replace it with omeprazole with famotidine. This will not affect the calcium absorption anymore for our patient.
All right, so I just spoke with your provider. We're going to switch your lorazepam to buspirone and your omeprazole to famotidine. So the first one's going to help with that dizziness spells you're feeling, and the second one's going to help with that bone loss that you're experiencing, okay?
I appreciate all you're doing to keep me safe. I don't want any injuries to happen when I'm working on the farm back at home.
Thank you, nurse, for listening to our concerns.
Thank you.
Of course, and bless your heart. That's what we're here for. You know, your safety comes first, always. I'll update the chart immediately so the changes are in place.
Thank you. Me and
Thank
my
you.
sister really appreciate it.
Thank you.
All right, have a good one. Oh, don't kiss.